The following portion of Good Day PA is sponsored by Keck Health. Imagine your health appointments being leisurely, never rushed. Your provider can be reached any day, any hour. There are no insurance hassles. This is Keck Health, a new practice opening on the West Shore. Co-owner and nurse practitioner Chris Keck is here. This must be exciting for you. You're about to open your own practice.
Yeah, it's fantastic. My wife and I, who's a registered nurse, Ari, we're opening this up, and we're super excited to open this up and to support Central Pennsylvania.
Very good. Now, I said this is a direct primary care practice. What does that mean?
So direct primary care means here that it's that you're getting primary care, but the financial, it's a alternative payment method. So instead of going through insurance, it's going to be a flat monthly subscription. And that allows for that continuative care, lack of the hassle with insurance, and it's just going to be more affordable, it's going to be more transparent, and it's going to be greater accessibility to getting your care.
How does it all work in terms of like referrals and blood work and all of that?
All of it's going to be very similar to what patients have already had done through their primary care providers. Some of the benefits is that I can actually draw the blood work myself since I was an ER nurse for 4 or 5 years. So it makes it more convenient for them. Additionally, I'll be able to treat them in the office. I can treat them through telehealth, and also I have the ability to even treat them in their own home as well.
Wow.
So there's that accessibility of getting to treat patients. That's something I think that Keck Health really sets ourselves apart compared to other practices.
Plus the relationship you're able to build with each client, right?
Absolutely. Within Keck Health, we're going to have a smaller group of patients. I wouldn't be, a primary care provider now is going to be treating 2,000 to 3,000 patients.
Whoa.
So that's a lot of work. Appointments are 15 minutes long, and it can be very difficult just to get the care that you need. At Keck Health, it's going to be an hour-long appointment. It's going to be a smaller group of patients just so I can provide that great quality of care, just so that I can keep people out of the hospital and just promote overall wellness.
Absolutely. So again, this is a subscription, right? So how does that work? Like, what are the monthly fees?
Monthly fees would be $50 per month for adults, $20 per month for children, and then a family, it wouldn't be any more than $140 per month. That includes all visits are included, sick visits, exams, any medical procedures that I would do, joint injections, biopsies, those would be included. The only thing that wouldn't be included would be like lab costs. But I've worked with labs down in Florida to try and find the most affordable costs, because I think when people get care, there's always this anxiety about how much is this going to cost.
Yes.
And my goal here is to provide accessible care and to make it affordable and also financially transparent, so people can not be afraid getting the care that they need.
That transparency is so lacking in the healthcare system. Just finally, why did you want to practice this way?
Right now, most of my experience has been within conventional healthcare in a 15-minute appointment, 4 patients an hour, and that can be really frustrating. And my goal is to provide the best care possible. And I think just from what we can see, just about burnout from primary care providers, is that can be very stressful. And I don't think it's in the patient's best interest. So I think that accessibility, those hour-long appointments, that smaller group of patients is a way to provide the best care.
Very good. Let's put on the screen where you're going to be opening. And also, I understand you have like sort of a get-to-know-me offer for viewers today. Yes,
I'm going to be offering free 30-minute enrollment appointments just so people can learn more about it. It's a new type of model. I think when people learn more about it, they're going to understand the benefits and how this can be a way to promote overall wellness, and just so that they can get access to care.
Yeah, and just open your mind to maybe an alternative to how it's been for you for so many years. Thank you so much. Good to have you. Congratulations to you.
Thank you very much.
The previous portion of Good Day PA was sponsored by Keck Health. We'll be right back.